Om Swastiastu. Hello everyone, we are from Small Group Discussion Basics and we will present to you our Small Group Discussion student project with the title Myasthenic Crisis. And this is the name and name our small group discussion member. Hello everyone, let me introduce myself. First, my name is Komang Tangkas Agnesnya and now with the last three digits number of 34. And now let's explain about myasthenic crisis. Myasthenic crisis is a severe complication of myasthenic gravis, an autoimmune disorder that weakens muscle by attacking acetylcholine receptor. During a crisis, muscle weakness can worsen drastically, especially in respiratory and facial muscle, leading to respiratory failure and requiring mechanical ventilation. Common triggers include infection and change in medication. Risk factors include comorbidities like hypertension and diabetes, and elevated blood cell count. Symptoms include difficulty swallowing, double vision, and breathing challenge. Diagnosis relies on clinical evaluation and specific tests. Treatment typically include respiratory support, immunomodulatory therapy like intravenous immunoglobulin or plasma exchange, and sometimes high-dose steroid. Prompt intervention can lead to recovery, though the condition remains serious. That's all for me. Thank you.
Hello, my name is Kalen Hertantan with the last three digits of my student number is 145, and today I will firstly state the problem that our student group discussion will discuss today. So firstly, we will discuss about what is the definition and epidemiology of myasthenic crisis, and then what is the pathophysiology of myasthenic crisis in the context of myasthenia gravis, and what is the common symptoms and signs associated with a myasthenic crisis, and then what are the current treatment options and interventions for managing this disease, and also how is the prognosis and possible complications for patients with myasthenic crisis. And next we got the objectives. So firstly, the general objective of today's student group discussion is to explore the physiological response and epidemiology of myasthenic crisis, as well as the prevention and management strategies for myasthenic crisis. As for the specific objectives, it is to define myasthenic crisis and understand its epidemiology, and then to explore the pathophysiology of myasthenic crisis in the context of myasthenia gravis, and then to identify the common symptoms and signs associated with a myasthenic crisis, to elaborate the current treatment options available for managing myasthenic crisis, and to analyze the prognosis and complications of patients with myasthenic crisis. As for the benefits of today's discussion, we hope that this student project will be able to give an understanding of the epidemiology of myasthenic crisis, which may improve the quality of life and outcomes in patients with myasthenia gravis, which is a medical emergency. The early recognition of symptoms will ensure that the patient receives timely treatment, hence reducing morbidity and mortality associated with the condition. Maybe that's all from me. Thank you.
Greetings, I'm Mario with pseudo number 123, and I would like to talk about the definition of myasthenic crisis. Myasthenic crisis is defined as a manifestation characterized by insufficient respiration caused by a myasthenia gravis disease, a disease that affects neuromuscular junction, and it is a condition where muscle weakness occurs in the respiratory muscles, which is essential for breathing, thus causing respiratory failures, and it is highly fatal. Some note that you might add is that it affects 15 to 20% of patients with myasthenia gravis. It usually occurs in the first 2 to 3 years of the disease, and in 18 to 28% of people that suffers from myasthenia gravis, the crisis is the first manifestation. The mean age is around 60 to 70 years old, and even though the patient survives, there's a 1/3 chance that the recurrent attack could occur. That's all from me.
My name is Nila Putiswari Adadarani with my last three-digit number is 183, and now I will continue about the definition and epidemiology of myasthenic crisis. In 18 to 28% of patients, myasthenic crisis can be the first presentation of myasthenia gravis. Elderly patients are more likely to be influenced with myasthenic crisis. In a few review retrospective observational studies, the crucial age at myasthenic crisis was around 60 to 70 years. years. A multicenter considered counting 59,000 patients, with 1,000 patients were hospitalized with myasthenic emergency between 2016 and 2018. Furthermore, the mortality of myasthenic crisis has decreased. Patients with respiratory shortcoming and indication that demonstrate an emergency ought to hospitalize promptly and watch closely for respiratory work. With early acknowledgement and dynamic crisis treatment, seriously care unit or ICU hospitalization and ventilatory bag may be maintained a strategic distance from. Thank you.
Hello, my name is Laura Natasha Pandaputi with the latest my student number 083. Now explain about the pathophysiology of myasthenic crisis. The pathophysiology of myasthenic crisis is related to antibodies targeting the neuromuscular junction. The first mechanism is through antibodies. Acquired antibodies bind to postsynaptic acetylcholine receptors in the motor and plate of skeletal muscles. Through degrading the receptors and decreasing the acetylcholine receptors contact area, this process triggers the complement system. The second one is muscle weakness. Acetylcholine receptor molecules will become non-functional when the acetylcholine receptors contact area is reduced. It prevents the postsynaptic potential, as the release of acetylcholine at the nerve terminal requires to generate an action potential in the muscle. This causes muscle weakness, which is worsened when a muscle group is used repeatedly. The third one is respiratory failure. The loss of functional acetylcholine receptor molecules can also cause respiratory muscle weakening, which is the cause of respiratory failure in patients with myasthenic crisis. That's all from me. The next material will be brought by my friend. Thank you.
Hello, my name is Audrey Esther with the last three digits of student number is 142. I would like to continue this presentation by explaining the clinical manifestation. So myasthenic crisis is a condition where myasthenia gravis symptoms worsen significantly, leading to respiratory failure and the need for mechanical ventilation. MC is characterized by weakness in respiratory and bulbar muscles, which can rapidly progress within minutes to days, resulting in faucet tetraparesis, severe dysphagia, and respiratory insufficiency. While respiratory failure is common, MC can also present with unusual manifestations such as sudden cardiac arrest, as reported by Andreev in 2020. Common triggers for MC include respiratory infections, certain medication, pregnancy, childbirth, surgery, and stress. There is also emerging evidence of a potential link between COVID-19 vaccination and the development of MC in MG patients, though this relationship is still not fully understood. Other risk factors include thymoma, which increases the risk of MC, while thymic hypoplasia appears to lower it. That's all from me. Thank you.
Greetings, Doctor. My name is Gabrielle from Rustafita with my last 3 digits and a number being 118, and today I'll look to continuing about the clinical manifestations, specifically about the clinical assessment severity and diagnostic measures. Clinical assessment of myasthenic crisis severity typically involves evaluating the respiratory function, evaluating the bulbar muscle weakness, and overall muscle strength. There's this scale called Myasthenia Gravis Activities of Daily Living, usually abbreviated as MGDL, which is a commonly used scale to quantify disease severity with an increase of 2 or more points indicating significant deteriorations. To conclude about what my friends Audrey have said, that myasthenia crisis is a severe, potentially life-threatening complications of myasthenia gravis, characterized by rapid progressions of muscle weakness, primarily affecting the respiratory and bulbar muscle weakness. It can be triggered by various factors, including infections, medications, and stress, and may present in atypical ways such as cardiac manifestations. Early recognitions and management are crucial as the severity can escalate quickly. That would be all from me. Thank you.
Hello, my name is Ananta Ismail with last digit number 198, and now I'm going to explain about the management of myasthenic crisis. Myasthenic crisis is characterized by a progressive decline in muscle strength, leading to respiratory failure. Thus, respiratory support is important in the management of myasthenic crisis. Intubation and mechanical ventilation are often necessary to secure the airway and prevent respiratory failure. The patient should be closely monitored for signs of respiratory distress. There are also treatments for myasthenic crisis. There are 2 primary treatments for myasthenic crisis. These include intravenous plasma exchange or PLEX and immunoglobulin or IVG. IVG is often used in conjunction with PLEX or as an alternative treatment when PLEX is not possible. Immunosuppressive medications such as corticosteroids are also used as an additional therapy alongside IVG and PLEX. This may reduce autoimmune response and reduce symptoms. Maybe that's all from me. Thank you.
Hello everyone, let me introduce myself. My name is Yanti Graciela. With my last 3-digit number is 162. I will explain the prevention of myasthenia gravis. Until now, there is no definite way to avoid this disease because these main causes of myasthenia gravis are immune and genetic factors. Myasthenia gravis disease cannot be cured, but it can control its symptoms. Some things that can be done to avoid symptoms are to maintaining cleanliness to avoid infection that can trigger it, stop smoking, avoid heat exposure, reduce excessive activity, control chronic disease, and reduce drugs such as aminoglycoside, fluoroquinolone, and beta blocker. The severity of symptoms can also be reduced by controlling stress. In addition, the annual flu vaccine can also have an effect because myasthenia gravis can occur due to infection triggers. For drug options that can avoid symptoms of myasthenia gravis include steroid drugs, immunosuppressive drugs, and anticholinesterase drugs. In addition, thymectomy and plasmapheresis can also be done to reduce the immune system attack on the nerves.
Greetings everyone, my name is Herbert with the 3 last digit numbers 169. I will now explain the prognosis and the complications of myasthenic crisis. So the most frequent complications of myasthenic crisis are fever, and there are also other risks of infections such as Clostridium difficile related infections, sepsis, and bacteremia. Comparing two groups of myasthenic gravis patients, one with crisis and one with no crisis, there are significant differences between them, especially in the risk of experiencing sepsis, cardiac arrest, congestive heart failure, acute myocardial infarctions, arrhythmias, and other cardiac complications. And these complications seems to increase the mortality rate in patients, while cases like atelectasis, C. difficile colitis, transfusion-dependent anemia could prolong the duration of myasthenic crisis intubations. And for the prognosis for patients with myasthenic crisis is now significantly increased nowadays. According to the US cohort studies, mortality rates for myasthenic crisis has declined from 42% in 1960 and decreasing to 6% in 1970. The majority of these patients also able to wean off their ventilator after 1 month of usage, and for long term generally, patients usually able to return to their normal life, be able to control if they are able to control their myasthenic gravis symptoms. However, some factors appears to be inhibiting a good prognosis, such as the patient's age and comorbid that they have. Also, history of severe myasthenic gravis or variant weakness and muscle-specific tyrosine kinase antibodies or MuSK antibodies and Tyroma increase the recurrence risk of myasthenic crisis. So, myasthenic crisis prognosis are always associated with long-term course of disease and outcome, and also the recurrence is heavily dependent on how the prevention strategies itself could effectively fend off the myasthenic gravis symptoms.
Hello, doctors and friends. My name is Tirza Fitania Maris with the last 3 digits of my student numbers are 060. So I will continue about the conclusion of this student project. In conclusion, myasthenia gravis is a chronic autoimmune disorder characterized by muscle weakness due to disrupted communication at the neuromuscular junction. The condition primarily affects the voluntary muscles, leading to symptoms such as ptosis, diplopia, and generalized muscle weakness. Understanding its definition, epidemiology, pathophysiology, and clinical manifestations is essential for accurate diagnosis and effective treatment. Effective management of myasthenia gravis typically includes medications such as acetylcholinesterase inhibitors, corticosteroids, and immunosuppressants, alongside surgical options like thymectomy in specific cases. Preventive strategies focus on minimizing exacerbating factors, and with early and consistent treatment, many patients can achieve substantial symptom control and an improvement of quality of life. That's all from me. Thank you.
Hello everyone, my name is Putu Disararanta with student ID number 021. So today I explain to you guys about our student project recommendation. So based on the result of our student project, there are several recommendations we can suggest. So further studies are needed on this disease, although some research has been conducted, many aspects are not still well understood. Additional studies are required to explore the causes and development of this disease in more depth. With further research, it is hoped that more effective prevention and treatment solutions can be found. And public awareness campaigns are also needed to increase the general public's knowledge about this disease. This is important to raise awareness of the symptoms and risk factors of the disease. Education can be carried out through various media such as health campaigns and counseling sessions. With better understanding, the public can take appropriate preventive measures. Okay, that's all from me. Thank you.
And that's it for our group presentations. Thank you for your attention, and besides, we apologize if there are any mistakes in our words and our doing. Thank you once again.